The opinions expressed by the host and guests in this show are not necessarily the views of Children's Health Defense.
Good morning, CHD. It is Wednesday, May the 27th, 2026. We're live here at CHD TV. We have a great show for you today. Coming up in a minute, we'll be talking to Mary Holland, our CEO and President of Children's Health Defense, on testing HPV vaccines on 4-year-olds. Then we are going to be going to CeCe Doucette with HHS Screentime warning, and then live with Dawn Richardson, help stopping the bad bills. Very important with Advocacy Lifeline there. But before we go to Mary, I just want to remind you, duty to disobey, that tomorrow is the last day you can buy tickets to tip your theatre. So we have tipped great many theatres around the country, but we still have more to go. So if you can, please do buy those tickets now at dutytodisobeyfilms.com and get those tickets, buy them for your friends, your neighbours. Everybody should see this film and at least tip that theatre. And then you have till the 30th of June to fill the theatre, where we will be live around the country for our worldwide premiere in theatres of Duty to Disobey, a film that Children's Health Defense is extremely proud of. Last night we did an X-Space on our main CHD channel, and I do recommend you please go and look at that, because we had a lot of military members on there talking about what they went through. It's a very good precursor to the film. So over there on our main channel and CHD TV Live on X, you will find that X-Space from last night. Right, let's go to our first guest, which is our Mary Holland. Good morning, Mary.
Good morning, Polly. Glad to be here.
Well, I also want to tell people, you're also the co-author of the HPV Vaccines on Trial book, which you can still get. You can get it on Amazon. I'm not quite sure where else you can get it, but I'm sure there are other places, Mary.
Yeah.
But a very important book, especially with what we're talking about right now. So let's go to this headline, please, Lou. So it's consultants are pushing HPV vaccines for infants as Merck tests Gardasil in kids as young as 4. And Mary, with all the research we've done, with the stories, your book, this is shocking, barbaric, no words.
No words, Polly. Right. So the HPV vaccine came out in the early 2000s, and before the COVID shot, it was by far and away the worst vaccine out there. It was killing people in their teens and 20s. It was causing paralysis. It was causing what's called POTS, postural orthostatic tachycardia syndrome. Kids were put on artificial lungs. Kids were put in wheelchairs, and this was happening globally. This vaccine was being pushed out first to girls, ostensibly to prevent cervical cancer. Then they pushed it out to boys, ostensibly to protect their partners from herpes, warts, and also from extremely rare cancers, penile cancer, other kinds of genital cancers. And then they've just kept pushing and pushing and pushing it. And Polly, thankfully, there's been global resistance to this shot because there have been so many injuries. Also, I should say, it very frequently causes infertility and causes cervical cancer and other genital cancers in girls and boys. So what does Merck do to make money with this product that they've already developed, that they already have some level of FDA approval for? They try to put it in a new age cohort. And their dream, Polly, even we covered this in the book in 2018, their dream has always been to make this for infants as early to birth as possible. Why? In my view, because there's plausible deniability. If a kid has a disability that arises at 12 months or 18 months, who's to say that they weren't born with that? Who's to say which vaccine it came from when they're also getting DPT, MMR, polio, Hib, etc.? So there's no surprise to me that they would be pushing this earlier. And as this fantastic article by our colleague Brenda Belletti points out in yesterday's Defender, they are having a surveillance for side effects, only swelling at the site of the injection for 3 days. They're doing this trial in Boston and in Gambia. In Boston, they're giving parents $400 gift cards. So they're buying participation by low-income parents who probably don't know better, frankly, Polly. And these kids, I would be shocked, Polly, if none of these kids develop serious side effects. The only thing they're looking for is the development of antibodies. They're likely going to get some antibodies developed after they give these injections. The Merck HPV vaccine, the Gardasil vaccine, is the only one available in the United States. And they're doing it in Gambia. Again, there's a lot of poverty in Gambia. Presumably, they're also giving some kind of financial incentive there. Sadly, the pharmaceutical industry has historically been using Africa and developing countries as their playground where, people have very little recourse. They have very little legal means to challenge these things. So what Merck wants is to go to then a phase 2 trial. But the good news, Polly, is why are they doing this? They're doing this because they're losing money. They've lost 40% of their sales for Gardasil because people talk. We talk. People are getting the message that this is a bad vaccine. It doesn't prevent, there's no proof, Polly, that it has prevented any cervical cancer. There's no proof of that. And there's a lot of evidence that globally fertility is declining. Is that because of the shot? It's not a one-to-one correlation. We can't say that it's absolutely provable, but we've proven lots of cases of autoimmune disorder, of POTS disorder, and of death from the Gardasil shot.
Mary, we've seen the injury firsthand of what's happened to these girls and boys, 16, 17 or whatever years old, and so much death. And the ones that didn't die, to talk about the agony and their brains on fire. And so can you imagine precious little 4-year-old having that injected into them? I mean,
well, it really just suggests the profound horror of the current global pharmaceutical industry. Why is this possible? It's possible because they have a liability shield for vaccines, which takes us to this bill in Congress by Representative Gosar. End the vaccine carve-out. Why should these corporations be liability free when you're injured or you die? There's no other products like that, Polly, that are for consumers. There's also no other products that the government can mandate. Several states have mandated the HPV vaccine. There are carve-outs in those states. There are religious exemptions. A lot of families don't know that because the states don't push it. So the fact that a product can be mandated and there can be a liability shield is an outrage. It is the end of market economics. It is the end of the idea of personal freedom, especially around medicine. Medicine should always be about prior free and informed consent for the individual. It should be about first do no harm. So this is an outrage that these vaccines, especially for HPV, this is not transmissible through breathing or through touching somebody. This is only through sexual contact, Polly. So this is a particularly outrageous vaccine. And the idea that they're trying to now find a new market is just really, it really tells us how cynical this industry has become.
And here's the saddest thing of all is that they're preying on the poor and the vulnerable. Yeah. So as you said, there's a $400 gift card or whatever to families right now who are struggling because food is expensive to pay their families. They're being lied to that this vaccine is safe and effective. So why would it not be in a 4-year-old? So, and they don't watch children's health events because they don't know about us. So it's a really barbaric situation. And Mary, how can it be legal that we're testing on infants and children who can't speak for themselves?
Well, Polly, this is why we are so strong about parental rights and why parents have to be the people to make decisions. Trust me, the pharmaceutical industry would like to be able to mandate that your child participates. This is an information issue. We should actually, Polly, we should have our legal team look at what is the document that those families get to sign in Boston. We should actually, I'm thinking about this now, we should find out what they are telling those families, because I would bet my bottom dollar that it is not a full disclosure of the information that any reasonable person would want to know about what are the potential risks for that 4-year-old. So we should look into that right now.
Yeah, Mary, and what can people do? So the average person watching now saying, this is barbaric. How can I help stop this?
So how you can help is any family that you know who might be participating in this, like tell them to watch this segment. if you have a family member with a child 9 through their 20s, tell them the HPV vaccine is dangerous. Look up our shows, look up the book, The HPV Vaccine on Trial. Just look on the internet. You will see how dangerous it is. This is a completely unnecessary, extremely dangerous, ineffective, unsafe vaccine, and people just get that word out. You can also reach out to your congressperson and say you support Representative Gosar's End the Vaccine Carve-Out. Why should a pharmaceutical corporation that has billions of dollars behind it, like Pfizer, have no liability for their products? It's ridiculous. In today's world, it is so dangerous that these mega global corporations are not responsible. Like plain English, if they kill you, they're not responsible. Even if they have some inkling that their product could kill you, they have no responsibility for that. Think about that. It's really a terrifying thought. So I think there's a lot we can do, and we are doing it, Polly. I want to be encouraging. We have tanked the teenage market, basically, for Gardasil, and they can try for 4 to 8-year-olds. I don't think they're going to succeed, but we have to keep up the pressure so that they know that this is cynical and unacceptable, and people won't go along with it.
Mary, before the COVID era, Children's Health Defence really were talking a lot about the HPV, and Dr. Suzanne Humphries called it the most injurious vaccine on the market. It has to go. Do we think that HHS may be looking at this HPV Gardasil situation?
Well, Polly, don't forget that what they did and the AAP litigation, American Academy, have held thing up. But Kennedy said HPV is no longer on the routinely recommended vaccine list for children. That is a major change. It is a shared clinical decision making now, according to what Secretary Kennedy issued in January. Now that's been held up, but he's already strongly signaled to the world this is not an essential vaccine and it should not be routinely recommended for administration. So he has already made a difference on this.
And so, Mary, to anybody watching that may be thinking about putting their child in a trial because they don't know any better, the truth of the matter is your child could die.
Polly, that is the truth of the matter. Sadly, because the pharmaceutical industry in this country is so rife with corruption and is so irresponsible because there is no liability, you cannot trust anything it says. I wish I didn't have to say that, but that is the God's truth. You cannot trust anything they tell you, and so you should stay away because they lie. They just lie to you about the real safety and efficacy. And so you cannot afford, even if you want that $400 and you wish you could believe them, you cannot assume that they are telling you the truth. You could really assume that they're not telling you the truth.
Because the bottom line also, Mary, is if your child is injured,
you're totally on your own. I always used to say, yo-yo, you're on your own. Your kid is paralyzed. Your kid needs a fake lung. Your kid develops cervical cancer. Your kid develops autism, all of which is possible from these vaccines. You are totally on your own. And trust me, the kinds of treatments you're going to get through your insurance or through Medicaid that you'll wait 5 years for are not going to help your kid. So you're going to be out of pocket hundreds of thousands of dollars if you can afford it. That is the reality. Do not go near a clinical trial because your life depends on it and your child's does.
Yes. All right. So everybody, so HPV Vaccine on Trial, you can order that book, but if you can afford that, please get that. Please share this show or others like it. If you go to CHD-TV, we have a whole HPV Gardasil section of stories of people that did take the shot and are either dead or injured incredibly badly. Please see those. Please share them. It costs nothing to share these stories because knowledge is key, and we need to warn the people out there of the terrible effects of HPV Gardasil. Yeah. Mary, thank you for being on this morning and for your knowledge. And we'll see you on Sunday with Mary and Polly.
Thanks, Polly.
Okay, everybody, we're now going to go to CeCe DeClerc with a warning from HHS. Good morning, CeCe.
Good morning, Polly. So nice to be back here with you again.
We love having you on CHD TV. Well, let's bring up this headline and have you tell us what it's all about. It says, breaking, HHS releases Surgeon General's warning on screen time for kids. So, CeCe, if you could break down what this means, and we're so pleased that...
Well, The time has come. I think parents in general have suspected that there's something not right about swapping out our kids' childhood for a screen. And there have been some excellent books written on that. I know that Jonathan Haidt's Anxious Generation got a lot of play over the last year. And there's so much more to the story. That was a wonderful article in The Defender that talks about the excessive screen time and how it's changing behaviors, how kids are not out playing where they should be, doing all their tactile development, learning how to interact with their peers and so forth. And I think parents know the jig is up. And a lot of schools right now are starting to do bell-to-bell cell phone bans so the kids can't bring their own technology into the classrooms. So that is one part of the opportunity for parents today, is to reduce the amount of screen time. And the other part is to reduce the amount of radio frequency radiation that's used for all of our wireless technology. So a lot of people have heard, oh, you need to not have blue light on at night before you go to bed because it's going to interrupt your sleep patterns. But what has not hit mainstream media yet is that it's not just the blue light, it's the actual way in which our signals are going back and forth. So what happened? How does the magic happen when we stopped plugging our devices in with Ethernet cables, right? We swapped it out for two-way microwave radio frequency radiation. That's literally microwaves that are sending our signals back and forth. And industry, kind of like what Mary just covered in that last piece, industry would have us believe that all Wi-Fi all the time is the way to go because they own mainstream media, and that's the messaging that we get. So I didn't know anything about this. I, in fact, was a culprit because I spent years bringing wireless technology into my kids' schools here in Massachusetts when the industry was pushing that 21st century classroom in. And we were a school district that had very limited budgets. So as a parent, I jump in and I revived our local education foundation. We did campaign after campaign to get wireless infrastructure, to get iPads and Chromebooks and smart boards and what we thought was all this amazing technology to give our kids a leg up. And then at my book group one night, a girlfriend of mine who's an electrical engineer said, "Hey, there's something wrong with wireless." And it took me some time to let that soak in, but ultimately, that MTPW after my name there means I had the privilege of earning a master's of technical and professional writing from Northeastern University. And I just went, well, is there any science to back up this claim that wireless is harmful? And Polly, as you know, it's just astounding to go find, and you don't even have to look far, you just need to know to look. Literally thousands of peer-reviewed studies all over the world showing that this excessive screen time, yes, is a major problem, but the radiation itself is perhaps even a bigger problem. We now have many studies showing anxiety, depression, sleep disorders, behavior issues, ADD, ADHD, autism, allergies, and the list just goes on through infertility and cancers. And this is a wonderful fact sheet that is with the Environmental Working Group. And I like to refer people sometimes to their documents because many parents are familiar with the Environmental Working Group because they're the ones who put out the annual list of the Clean 15 and the Dirty Dozen, which apply to the pesticides that are applied to our food source. So as a mom, I knew about that Clean 15 and Dirty Dozen. And so I was elated to find out that they also have put on staff a PhD who works on this wireless radiation issue. So they have fact sheets that are easily accessible. So know your audience. And I'm grateful that we're going to put these links in the show notes for everybody. But they have one called The Effects of Radio Frequency Radiation on the Nervous System. So again, We are literally pulsating ourselves with man-made radiation day and night. They also have one called How Exposure to Cell Phones and Other Technology Affects the Reproductive Health. And again, we know that the studies are telling us, and these were the studies that actually got me on my feet with this topic. They've taken male human sperm and exposed it to wireless antennas, and it changed the DNA, which is our roadmap to grow proper anything from a child to a plant to a pollinator. It changed the DNA. It slowed the motility of the sperm, and it caused programmed cell death or apoptosis. It was literally killing off the sperm in 4 hours of exposure to a laptop. And where were my kids using their technology, but right on top of their reproductive organs? And Kaiser Permanente has come out with another amazing study on women's reproduction that shows higher miscarriage rates and so forth when we choose to unwittingly expose ourselves to this man-made radiation. And then they also have one specifically for children. It's called Protecting Children from Wireless at School and at Home, because our kids are immersed in this invisible field of electropollution 24/7 now. So we now have wonderful resources. If you pull up those fact sheets, and I want to give a huge shout out to Children's Health Defense, because Miriam Eckenfels and her team at Children's Health Defense with Stephanie Laprocio and others, they have a lot of these resources out on your website too. So the information is there. We just need to know to look. And this 704 No More is a fantastic website, because once this sinks in and we figure out that, just like Mary was saying, with the pharmaceutical industry that has gotten themselves protected by taking no accountability for the harm that the vaccines are doing, the telecom industry has done the same thing. They worked with our legislators back in 1996 on the Telecom Act, the Telecommunications Act, to basically say, if anybody's got a problem with health or environment, sorry, can't sue us, right? And that clause is tucked into the Telecom Act in Section 704. So with great thanks to Children's Health Defense, there's this whole effort now called 704 No More, where we are working hard to try and stop and reverse that 704 clause so that there is accountability, right? So that's what they say. No local government can regulate the placement of these cell towers and stuff. But we actually have a Supreme Judicial Court case here in Pittsfield, Massachusetts, that Children's Health Defense is doing the legal representation on. So a big shout out to Scott McCullough, and also the local attorney here in Massachusetts, who his name is Paul Revere III, and his great-great-grandfather was the first president of a board of health here in Massachusetts. So maybe it's symbolic that we have Paul Revere working on this case too. So industry has tried to tell our towns that their hands are tied. There's nothing you can do. If they want to put a cell tower or one of these 5G small cells right outside your window, gee, you're just out of luck. And that's not actually true. That's what they're told. So go out to 704 No More and join our efforts. There are more than 100 organizations across the nation that have joined on with this. So we are showing power as a voting bloc. And it's critically important that other groups join in, because, as it says, together we can win. And then Children's Health Defense also has another program going, and that's the Stop 5G Community Empowerment Consulting. So sometimes you do have to get a good attorney, and we're very fortunate that the attorneys at Children's Health Defense and other groups understand what the industry playbook is, because a lot of them came from industry. So they know what the industry is doing, and our local municipalities don't. So a lot of communities will put their pennies together, hire a good attorney. I know that they will do an initial free consultation, but sometimes you do have to bring the legal muscle to get our local towns to really understand what this is. And more importantly, to know what rights they do have, even under current law, to put clauses in our local zoning bylaws to protect our population. So,
I didn't mean to interrupt you, but we've only got a few minutes left, and I really want to go back to the screen time that HHS are talking.
yes.
So here's the problem. Okay, here's where we are in 2026. If you drive down the road and you stop at the lights and look over to the car next to you, you will see a family, mother and father in the front seat, scrolling, waiting for the lights, children in the back on the iPads. If you go to the park, we'll see mothers strolling around with their baby, not looking at their baby, but strolling on their phone. We have a serious problem. It's the children is one thing, the adults are addicted, the parents are addicted. And then I got into a group with some parents and we were talking about this, and they were saying, and this is a group of unvaccinated parents I was meeting with, and they said their children are literally out of control when they take away an iPad. And even the ones that said we have no iPads, but I allow them to watch God knows what on TV for half an hour or whatever every day, when they turn the TV off as well, there's tantrums to the point where you've got a 5-year-old saying, I want to kill you, mummy. So we have got to address the addictiveness, whatever it is with these screens, the parents
And it is, Polly, it is hitting the same receptors in our central nervous system as drugs, alcohol, pornography, gambling, and tobacco. So when you use the word addiction, we're not using that lightly. We have studies showing it is a neurotoxin. So let's look at solutions. Right? We broke it, we can fix it. There are incredible resources. Education is going to be the key. And we're very fortunate. My partner, Dr. Mikko Ahonen, is one of the leading scientists on this out of Finland. He and I have worked on putting together a very simple online course, saferscreentime.org. And you can go to Safer Screen Time and take this course in about an hour. Have all your loved ones take it at the same time, and then sit down and talk about what this is, right? And you have a handy tip sheet you can print out at the end. If you want to train your whole workforce, there's a certificate of completion to give to your human resources department. So we know how to do this. And Dr. Victoria Dunkley is quoted in our course, and she has a wonderful book called Reset Your Child's Brain. And literally in a 4-week program that you design, you will help to end these meltdowns, raise the kids' grades, and boost those social skills back to where they need to be by reversing the effects of screen time. So we know what to do. I do a free public education webinar every month, so anybody can come in when you join the conversation. You're going to have questions. We'll present the facts. At the end, we will then do a live Q&A with you. And we're actually doing one tomorrow night at 6 p.m. Eastern. So go to my website, Massachusetts for Safe Technology, register. If the time doesn't work, we will go ahead and send you the recording in my slides. So just know there's hope for everything. And if I could close with saying, thank you again to the incredible work that Health and Human Services Secretary Robert F. Kennedy Jr. is doing, because if you look at the Make America Healthy Again strategy document, you go to page 7, and they are saying we are going to address this man-made electromagnetic radiation. So there is hope everywhere. But, Mary was saying, yo-ho, you're on your own. Well, I always say there's no cavalry coming. So big things are happening in the background, but that's not going to help your child or you today. So come learn, we'll hold your hand, and we'll help you get to where you will have some sanity back in your household. But the message is not no technology. It's safe technology, and we can help you get there.
Okay, but just before we go, I just want to say I spoke to a very good friend of mine the other day whose son goes to mainstream school, and the school have stopped bringing in their cell phones. And he said within 2 hours, his son was calling him from inside the school. And he said, how did you get that phone? And of course, these teenagers, they've got it all hidden around the school. So we have to be smarter than these teenagers.
I've heard some will bring a dummy phone in and turn in the dummy phone, and then they keep the real phone with them.
These teenagers are smart, and we were all the same when we were younger, so we're not judging. But
yeah, but you know what, Polly? You get a radio frequency detection meter. This Safe and Sound Pro 2 was recommended at the EMF Medical Conference, and every school should have one because they can just walk around and know if there's radiation transmitting, put the wireless access points on a timer so the teachers only turn on for the shortest amount of time they might need to upload or download data. And then you shouldn't have wireless on in the classroom. So we just need to get smart about this, and we have the tools to do it.
Well, CeCe, we do need to get you back on again because we're preparing for our back to school schedule.
Yes.
So we definitely want you back on. So we're thinking about that. But CeCe, thank you for being on this morning. We ran out of time, unfortunately, with so much more to talk about. But thank you for all you do as well.
Betcha. Right back at you, Polly, and your whole team there. Thank you.
We'll see you soon, CeCe. And now we're going to go, everybody, live over to Dawn Richardson for a very important show on bad bills.
And welcome to Advocacy Lifeline. You're live here on CHD TV. So as you're hearing about our topics today, please engage in the comments and let us know what you're thinking, if you have any questions or anything like that. Thank you so much for joining us. The purpose of this show is to help empower you, our viewers, to use your voice to affect change in law, policy, and public opinion through education and action for issues that are important to you and your family. This is not to be construed as legal or medical advice because it's not. These are my opinions. These views are my own and not necessarily the views of CHD or the National Vaccine Information Center, where I work full-time as the Director of Advocacy. We are just about at the end of May, and while several state legislatures have concluded their sessions for 2026, there are still many in session that have some really bad bills moving. Today, we are going to highlight damaging bills that are moving where if we have enough grassroots action, we could actually kill them. So I am asking everyone watching to help stop bad bills moving in California, Colorado, Delaware, Louisiana, Massachusetts, New Hampshire, New York, and Pennsylvania. If you don't live in one of these states, that's okay. You can still help. Please forward this show to anyone you know who does. Everyone in any of these states needs to contact their legislators to either oppose the bills we're going to talk about, and I'm going to tell you exactly who you need to contact in your legislature, or even to contact the governor if it's already passed to veto them. I am going to give you just some of the more offensive parts of these bills so we can bring the necessary attention to them. And so I'm going to also try and move through them quickly because there's quite a few. And I just want to remind everybody that every bill that I'm going to talk about today will be it is posted on the NVIC advocacy portal at nvicadvocacy.org. And you're going to go to the state page on the portal for that state, and then that's where the bill is posted. And when you click on the bill number, you're going to have a full analysis, the status broken out, giving you the details exactly where the bill is at, a position statement of why you should oppose it, and also directions for action. Because as the bill goes through the legislature and stops in different places, you want to make sure you're directing your action to the right people, to the right committee members, to your legislator, to the governor, and wherever it's going to be the most effective to exert the most amount of change. All right, so let's start with the state of California. We have California AB 2651, and this bill requires a school, pre-K, preschool, or daycare to notify parents within 10 days if the vaccination rates at the school drops below rates established and updated by the California Department of Public Health. This bill jeopardizes the right to medical privacy for families who claim exemptions. Now, there are still families in California, some of them that actually can get exemptions in school if the kids have IEP plans or there's other possibilities. But I'm surprised, why are they even doing this? Because they got rid of exemptions in California. And It must be a compliance issue where the schools are looking the other way and letting unvaccinated kids attend and not enforcing the law, because otherwise, who's left unless they are just shirking their duties? So the problem is, when you have exemption numbers small enough that would be, if they would be low, very low within some communities, like child care centers, small child care centers, these families may be easily identified by other families based on some of their other lifestyle choices to be more naturally health inclined and less medical intervention. And so if the whole school, everybody, all the families of the school or daycare are notified that the exemption rates or the vaccination rates or exemption rates are at a certain point, this enables these families to be identified, and it enables targeted discrimination towards families and children based on their vaccination status. The bill requires minimum vaccination rates to be arbitrarily established by the State Department of Public Health, and even though vaccines, when kids have them, it doesn't necessarily guarantee protection for either the people vaccinated or those around them. People can still get infected and transmit. And we've talked about this many times on other shows. And so it doesn't make sense to set the stage for potential discrimination against families who have chosen not to have their children receive certain vaccines. And some of these kids, they can't even get these vaccines because of past reactions or medical conditions. Because vaccinated individuals, bottom line, can still become infected and transmit. So this is just a bill setting up the stage for discrimination. And you're going to want to contact your assembly member, your senator, and you're going to want to ask them to oppose this bill. Okay, next slide. Colorado, House Bill 1425 mandates vaccines for children attending applied behavioral analysis ABA clinics and allows only unguaranteed short-term attendance for children with an unverified vaccination status. This one has gone all the way through, and you're going to want to contact Governor Jared Polis at 303-866-2471 and ask him to veto this. This is an absolutely horrible bill trying to coerce those with autism and other developmental disorders to get more vaccines by withholding ABA treatment over vaccination status. Some of these children are vaccine injured. That's why they're going for these treatments, and keeping them from their treatment, which helps them with their vaccine injuries over their vaccination status, is unconscionable. All right, let's move on to Delaware. Delaware House Bill 338. This requires health insurance carriers to provide coverage for vaccines recommended by ACIP and guidelines supported by HRSA in effect as of 1/1/2025. All right, let's break this down a little bit. This one, it's already passed the House and the Senate committee, so you're going to want to contact your senator and ask them to oppose. So I know a lot of states have said they're going to get rid of ACIP, but a state doesn't necessarily have to get rid of ACIP influence. They can set other guidelines to be, in addition, and that's what this one has done, supported by HRSA in effect as of 1/1/2025. That's basically freezing the current schedule. So the effect of this would be if ACIP got rid of some vaccines on the schedule and took them off, the health insurance providers in the state of Delaware would still be required, if this bill passed, to provide coverage. This bill is actually part of an effort to work around vaccine recommendations by ACIP. This backlash against ACIP is happening because the federal public health agencies run by HHS Secretary Robert F. Kennedy Jr. have been trying to increase the vaccine safety in the schedule and transparency, and remove some vaccines from the recommended schedule. So if insurance companies are required to pay for more vaccines, that raises premiums for everybody, even those who don't take all the vaccines. And every time you raise a premium, less people have coverage. They lose coverage because they can't afford it. So that's why this is a bad bill and needs to be opposed. All right, let's move on to Louisiana. There's 3 bad bills in Louisiana, and Louisiana has some really great bills. So this is unfortunate. And as of the case in some of these bills, the bills started great or better, but then they were amended and took them down a notch. So we have Louisiana House Bill 775. What this bill does now, and I'll explain that in a second, but it allows minor consent for sexually transmitted infection vaccines. So things like HPV or hepatitis B. So it would allow a minor to, on their own, consent without parental knowledge or consent. It also allows a healthcare provider to assume, with complete liability protection, no liability whatsoever, they can assume parental consent to a vaccine for a child based on an unverified temporary custodial claim. So like a grandmother could bring, or an aunt or an uncle could bring a kid into the doctor and say, oh yeah, their mom wants them to get all the vaccines and catch up. So the provider would have complete liability protection. They could do it. They could, based on good faith, that this is what's being represented. And they don't even have to take any effort at all to verify that that's the case. And they're protected from liability when they do that. Now, remember, on our last show, we covered this bill. And then it allowed for 17-year-olds consenting on their own, but you had to have parental consent for everybody else. And y'all stepped up, people contacted the committee, and then what they ended up doing is they did amend the bill to up that age to 18, but then they had to go and ruin it by amending to add minor consent for any prevention for sexually transmitted infections. Well, that's just a cover-up for vaccines. That's what doctors mean by prevention. They want to give the vaccines. And so there was this whole other section on top of that that would allow a healthcare provider to assume without any liability parental consent based on a temporary custodian's claim that the parent wanted this, and the provider wouldn't even have to verify it. This is such a bad bill. Go ahead. It's already passed the House. It's up for a final vote in the Senate. Contact your senator now and tell them to oppose this bill. There's nothing that's going to fix this unless they rip all that junk out that they just put and just leave the upping the age to 18. It started off, better, but now it's worse. But it was still bad before, and it just went from bad to worse. Okay, second bill in Louisiana, House Bill 926. This prohibits government vaccine mandates and vaccine status discrimination, which is all great, but then they go and accept out health care. And then it prohibits the healthy or unvaccinated in an outbreak or emergency. So it prohibits excluding them, but then it accepts out schools or childcare. So the problem with this bill is not what it's saying, it's who they're excluding and who they're throwing under the bus and say, you don't get that protection. So right now, you're going to need to contact the Senate Health and Welfare Committee members and your senator and ask them to oppose this. Although the bill is now titled the Louisiana Medical Freedom Act, this exclusion of government healthcare entities from the prohibition of medical intervention mandates signals that the state of Louisiana approves of doctors' offices, hospitals, licensed healthcare providers and facilities, medical centers, and nursing homes mandating medical interventions like vaccines. This is not medical freedom. Additionally, the people of Louisiana deserve the protection from businesses requiring vaccines for employment or access to goods or services as stipulated in the introduced version of the bill. We all witnessed the harm caused by adult vaccine mandates by businesses during the COVID era, and some healthcare workers are still discriminated today against, based on their vaccination status. Also, no healthy child should be excluded from school or daycare just because they have declined a medical intervention like a vaccine. All right, the final bill in Louisiana. House Bill 1041. This prohibits vaccine mandates and vaccine status discrimination except by all healthcare facilities, healthcare providers, and healthcare employers. You're going to want to contact the Senate Health and Welfare Committee members and ask them to remove this exception for the healthcare facilities, healthcare providers, and healthcare employers. This is a good bill, except for these exceptions, because it prohibits the vaccine mandates and the vaccine status discrimination, except for these exceptions that we have to have removed. The bill would be good if it weren't for these exceptions. And listen, y'all know I'm opposed to all vaccine mandates. I support an individual's right to informed consent, which includes the right to refuse a vaccine without harassment, coercion, or penalty. Vaccines, just like all pharmaceutical products, carry a risk of injury and even death, and no one should be forced to take on such risks just to receive a medical care or as a condition of employment in one of these medical facilities. All right, moving on to Massachusetts. Two really nasty sets of bills here. You know, we've got companions with this first one. This bill, Massachusetts H2554 and S1557, eliminates religious belief exemptions for vaccines required for school, and it requires the department to publish exemption data. You are going to want to contact the House Ways and Means Committee members, your representative and senator, and ask them to oppose. I'm just going to give you a quick note here that all these committee members and their contact info is listed on this bill post on the NBIC advocacy portal. This bill hurts families who object to vaccination based on sincerely held religious beliefs. These families will face unfair vaccine status discrimination in being denied a public, private, or charter school education for their child based solely on their sincerely held religious beliefs. I just want to bring up, because a lot of people don't look at their state constitutions when fighting bills. And these bills are actually in violation of Article 2 of the Massachusetts Constitution, where it says, "And no subject shall be hurt, molested, or restrained in his person, liberty, or estate for worshiping God in the manner and season most agreeable to the dictates of his own conscience or for his religious profession or sentiments." So I don't understand how a legislator can even get away with filing a bill that is in such blatant disregard to the state constitution. So that is something to definitely talk about when you're contacting these committee members and your rep and your senator to oppose this bill. All right, the next bill in Massachusetts, S2623, and now the number, it's been substituted with this number S3070 because they've replaced the language. But this is basically, it's hard to get this in a summary, but it's a government takeover of all medical and religious exemptions. And they're adding many exceptions and exclusions on the exemption based on whether or not the school is deemed to have an elevated risk, which this, is based on how many people have exemptions. And so they're going to try and limit how many people can use exemptions. The bill also allows minor consent to vaccination, and it requires child care facilities and schools to report exemption data. So that can be sliced and diced to use for these elevated risk profiles and trying to restrict the exemptions. This bill is now, you're going to want to contact Senate Ways and Means Committee members and your representative and senator and ask them to oppose it. There are so many problems with this bill, so I'm going to direct you to the NBIC advocacy portal to see the bill post, and you can get all the information on this one there. But those are the worst parts of it. Okay. Now, moving on to New Hampshire, House Bill 1219. This prohibits vaccine requirements for adults residing in foster homes from exceeding the requirements for children listed under statute currently. This was already been sent to the governor. You're going to want to contact the governor at 603-271-2121 and ask her to veto this bill. This is terrible. This is changed from this bill was changing from existing law that doesn't currently authorize parents or adults residing in a foster family home to be required to be vaccinated. This is like a new market they're going for, to try and stick it to these families. This bill establishes the authority for the state to require vaccines for any adult residing in the foster home, including but not limited to the foster parents. This is a massive expansion of vaccine requirements in the state for foster families and could have a negative impact on the number of families willing and able to be able to foster a child in their home. I know there's already an excess number of kids compared to foster parents willing to take these children in. You go and then say the parents could be vaccinated up to everything that the kid is required to get. That is ridiculous. Just stop. I wonder which lobbyists were behind this one, who are going to make a lot of money from vaccinating all these parents. Okay, let's move on to New York. I just have to sigh here for a second because New York is an absolute nightmare in the legislature. There are 64 opposed bills in New York that I'm tracking. I can't cover all of these on one show. If you're in New York, you're going to need to go to the portal and you're going to need to see these for yourself. Now, we always give you the next action. We tell you where the bill is at, so you can use that information, to be able to contact legislators. Now, I'm going to highlight the ones that are dangerously close to passing. So if you're in New York, these are ones you're going to want to concentrate on now. But you're also going to want to pay attention to the other bills that are continuing to move. All right, New York A 3254A and S 395A. These bills mandate certain vaccines on children's camp attendees. And there are only limited medical exemptions available. This allows for additional vaccines to be required based on trade groups and other international organization recommendations. We're giving it away, people, to like the World Health Organization and other groups to add and pile on these mandates for poor kids attending camp. This has already been sent to the governor. You're going to want to contact Governor Kathy Hochul at 518-474-8390 and ask her to veto this bill. This bill discriminates against children who want to attend camp but whose parents have chosen not to vaccinate. New York already got rid of the religious exemption for school, and now these kids who are homeschooled and just want to have some normalcy and go to camp, who don't have all the vaccines, they're not going to be able to go. So the governor has to veto this. New York is just getting worse and worse, and I'm so sorry. Y'all that are still there, you have to fight. You have to show up and fight. Who knows what could happen? So I know it's kind of bleak, but you have to try. Okay. The next New York bills are A2078 and S5724. This requires college students to get the hepatitis B vaccines. You're going to want to contact the Senate Health Committee members and your assembly member and senator and ask them to oppose. This whole section that Mary just did previously with Polly on Good Morning CHD tells you all these problems with the hepatitis B vaccine and the HPV vaccines. She had mentioned both of them. So I just want to let you know that hepatitis B infections are rare in college students, while medical and religious exemptions to these proposed mandates are available in college according to the current law. But students who wish to decline the hepatitis B vaccines for conscientious reasons or just for any reason will no longer be eligible to attend post-secondary schools or colleges in New York. That's going to affect people who come in from out of state. If you're wanting to go to these elite colleges in New York, and you don't have the types of exemptions that are available, you're not going to be able to. And so these these bills, regardless of the existing exemptions, they put undue pressure on students to take a vaccine they may not want or need. There is no need for a mandate. Anybody can get that vaccine who wants it. And because New York already got rid of religious exemptions for school children, relying on exemptions in New York is obviously a risky proposition. They got rid of exemptions before, and they'll likely try to do this again for the college age students. And so I'm opposed to all vaccine mandates and the expansion of existing mandates. Vaccines, just like all pharmaceutical products, carry a risk of injury and even death and should not be required as a condition of school attendance at any level. All right, moving on to New York. A9140 and S9604. This establishes state liability protections for vaccine administrators for any vaccine injury, with exceptions for willful misconduct and gross negligence, that covers next to nothing. You're going to want to contact your Senate Health Committee members and your Assembly member and senator and ask them to oppose it. These bills authorize the state of New York to extend liability protection for vaccine administrators beyond what is already provided by federal law in the National Childhood Vaccine Injury Act of 1986. By passing laws that remove liability, states may extend liability protection to vaccine administrators who administer vaccines that may have been removed from the CDC recommended schedule by ACIP. And this, for any, say that ACIP thought some of the vaccines were unsafe, ineffective, or unnecessary, this would allow these people who give the vaccines to still have liability protection if they're vaccinating outside of that schedule. So, protecting a vaccine administrator who administers vaccines that are no longer CDC recommended or ACIP recommended increases the risk of injury and even death for children in the state. The huge problem with this is that these recommendations that are done, they actually translate into mandates, and New York doesn't have a religious exemption. There's going to be even less incentive for a provider to question giving a vaccine that goes beyond the schedule, that if they can't be held liable. So it's very concerning. All right, next bill, New York A3892 and S4548. This permits dentists to administer vaccinations against HPV. Oh my gosh, you're going to want to, this is the dumbest bill. You're going to want to contact the Assembly Health Education Committee members, your Assembly member and senator, and ask them to oppose. These bills trivialize the very real risks and serious reactions associated with vaccination by allowing dentists who do not have enough training about vaccine risks to administer the HPV vaccine. Dentists do not have adequate training regarding vaccines, risks, pre-screening, contraindications, and emergency interventions for reactions, or even reporting reactions to the vaccine adverse events reporting system, and advising patients about the statute of limitations and instructions for filing a claim for injury with the National Vaccine Injury Compensation Program. Also, the HPV vaccine shouldn't be given. In most cases, 9 out of 10, HPV goes away on its own within 2 years without any health problems. Most HPV infections don't cause cancer, as they are kept in check by a person's immune system. Cancer often takes years, even decades, to develop after a person gets HPV. There's no way to know who will develop cancer or other health problems from HPV. The vaccine wears off. And again, you've heard over and over again all the problems with the HPV vaccine, as Mary Holland talked about in this morning's episode of Children's Health Defense's Good Morning CHD show. Okay, now we're going to go to the next slide on New York. A5460D and S5340C. This allows medical assistants to administer any recommended vaccine under supervision, and it directs commissioners to consider trade organization vaccine recommendations into the mandates. You're going to want to contact the Assembly Higher Education Committee members, your Assembly member and senator, and ask them to oppose this bill. These bills actually endanger the safety of patients as medical assistants are unlicensed employees who are not medically trained. You know who a medical assistant is? It's the person that when you go into the office that comes in and they take notes about, oh, what are you here for today? Okay, then as they're leaving, they say, okay, the actual doctor will come in shortly, or the nurse practitioner, or somebody who's actually medically trained. So this would let these people who are just note takers give the vaccines as long as there was someone there supervising. I'm sorry, who's going to allow that with their kids? But people might not know. And if this passes, the kids are going to be, people are going to be endangered. They're not trained. If a patient were to have a vaccine reaction, a medical assistant would not be able to give the same medical care as a licensed physician during an emergency, or they could even improperly administer the vaccine, causing the patient harm. Have you guys heard of CERVA? That's the injury name given to when they damage the shoulder, and then you have permanent harm in your shoulder where you can't move your arm properly. Non-medically trained and not medically licensed medical assistants should not be administering vaccines that carry a risk of injury and even death. Bottom line, bad bill needs to be stopped. All right. New York's A5152B and S7025B. This expands a pharmacy technician's authority to vaccinate and allows the administration of all vaccines in all places that a pharmacist can. This is somewhat similar to the bill we just talked about. We're talking about unqualified, unmedically trained people giving vaccines. And so you're going to want to contact the Higher Education Committee in the Assembly, your Assembly member and your senator, and ask them to oppose this bill. These bills, they actually trivialize very real vaccine reaction risks and serious reactions that can occur following vaccination by allowing non-medical professionals to administer possibly life-threatening vaccines to adults and children. CPR, or basic life support, is not a suitable substitute for medical training. They added that in thinking that's going to alleviate people's concerns. Big deal. At 15 years old, when I was going to be a lifeguard, I learned how to do CPR. Could I have given a vaccine and screened for side effects? I don't think so. Both pharmacy technicians and pharmacists are not medically trained healthcare providers, and they're not qualified to be authorized to administer vaccines, and yet here we are. So this bill needs to be stopped. It's already bad enough the pharmacists are giving a pharmacy tech who, doesn't even, in some cases, have to finish high school. They could have a GED. They're not even guaranteed to have had a biology class. They have no business giving vaccines. All right, 2 more bills here. We're going to talk about Pennsylvania real quick. Pennsylvania, House Bill 1828 and Senate Bill 989. These bills authorize the state to require health plans to cover vaccines recommended by medical societies outside of the CDC, FDA, and ACIP recommendations. You're going to want to contact the Senate Banking and Insurance Committee members, your representative and senator, and ask them to oppose this. This bill would allow the Commonwealth of Pennsylvania to require that insurance companies provide insurance coverage and reimbursements for vaccines that are no longer recommended by the FDA, CDC, or ACIP, or given in a series or manner that's not recommended. The required coverage of vaccines recommended by the professional medical associations and the Department of Health will cost all insurance enrollees more money. When coverage for certain medical interventions is mandated, costs go up for all health plans and people lose coverage due to the increase in health plan premiums. This bill prioritizes vaccine coverage over insurance coverage for citizens. And we talked about another bill just like this. All right, last bill for the day, Pennsylvania, House Bill 1881. This regulates the profession of pharmacy technicians and expands the number of vaccines pharmacy employees can give to include vaccines determined by the Pennsylvania Department of Health. So they're trying again to make sure that they can give any vaccine, even if it's not recommended by the CDC or ACIP anymore. You're going to want to contact the Senate the Senate Consumer Protection and Professional Licensure Committee members, your senator, and ask them to oppose. So These bills expand the number of vaccines pharmacy employees are authorized to administer to include any vaccine adopted by the Pennsylvania Department of Health and not just those licensed by the FDA or recommended by ACIP or the CDC. This change would allow the Department of Health to add or exclude a vaccine that pharmacy employees are authorized to administer to individuals as young as 5 years of age for some vaccines outside of federal health recommendations, based on reports by various medical trade groups that have conflicts of interest, like the American Academy of Pediatrics, the American College of Obstetricians and Gynecologists, ACOG, the American Academy of Family Physicians, and other medical trade associations whose membership financially profits from vaccine administrations and are more likely to recommend vaccines that federal health agencies may no longer deem safe or necessary. Pharmacy technicians are not medically trained and should not be giving vaccines, period. And honestly, even pharmacists are not. So this whole slew of bills trying to expand what these people are giving in the back of a grocery store and a pharmacy, just please stop. So, all right, guys, in closing today, important for you to share the show with others, especially families, legislators, and their staff in the states of California, Colorado, Delaware, Louisiana, Massachusetts, New Hampshire, New York, and Pennsylvania. You can go to the CHD TV website and under shows, pick Advocacy Lifeline, copy the link to this week's show, and share it. Sign up for the advocacy portal at nvicadvocacy.org and commit to taking the simple steps we share to help you make your voices heard with your legislators. This is where you'll find the bills that I talked about today, and all the information is there. Please consider making a donation to CHD and NVIC so we can keep up this important work. I want to give you all a special thanks to all our listeners who joined us today and who are committed to using your voice to make a difference. We're going to be back 2 weeks from today on Wednesday morning, June 10th at 10:30 Eastern Time, 9:30 Central Time, and 7:30 Pacific Time. God bless y'all. God bless America, and we'll see you in 2 weeks.
Can you tell everyone your name, please?
Sure, Jennifer Oliver.
Okay, so this is a story about your son. How old is he now?
Ethan is 14 years old now.
And is he your eldest child?
Yes, he's my oldest child.
Oldest child. Okay. So when you were pregnant with him, did you ever have a conversation about that? You're medically trained, correct?
Yes, ma'am. I'm an RN.
Right. So did you have a conversation about any potential dangers of vaccinations?
No, nobody had any conversations with me.
Did you have any shots when you were pregnant?
No, I did not.
Okay. So tell us what he was like when he was born.
Ethan was a healthy little boy. He was breastfed. He grew like you would think he should grow. He was happy. He was healthy.
Sorry, just pause for 1 second.
Okay.
I just forgot to do that.
Okay, where do I start back at?
Oh, yeah. So, guys, well, we are actually live. I just forgot to put a microphone on you. Sorry. So, you talk to us about how he was when he was born.
Ethan was a healthy boy. He was 6 pounds 12 ounces, and he was perfect. He never had a health issue, and he grew. He met all of his milestones on time, and he was perfect. There was nothing wrong with him.
Okay, so talk us through what happened with his life till he got this diagnosis.
So I had vaccinated him, and then when it came up for his 2-year shots, I had this gut feeling that I shouldn't do it, so I postponed his appointment several months. And when I went into the pediatrician's office, I told her that I was really concerned about the vaccines this time, and she pretty much told me that there was no reason to be concerned, and that I was a nurse, and that I knew that we had to give these, and we gave them. And the minute that they gave him the shots, I knew we had made a mistake.
What was happening?
I just knew in my gut that something was going to go wrong. And 3 months later, he was diagnosed with acute lymphoblastic leukemia.
3 months later? So what were the symptoms that led up to that made you think he was sick?
So he had a virus, just a simple virus, 1 or 2 days, felt bad, laid around, low-grade fever, had a little diarrhea, no big deal, didn't even take him to the pediatrician. After that, he continually stayed tired. Then we would be walking like in the mall, and he would be hunched over like he couldn't walk anymore. He started having bruises in places that normal, healthy kids don't have it. It wasn't on the front of the legs if you were playing and falling, but on the back of the legs, below the belly button, places that you wouldn't normally have bruises. And so I took him to the pediatrician's office and said something's wrong. They did some lab work, thought it was ITP, and gave him his flu shot.
They gave him a flu shot?
They did. Mm-hmm. So we came back in 5.
Why did they give him a flu? What was the reason?
It was flu season.
Okay.
And I was a mess, and talking to the doctor, they kind of just came in and kind of did it, didn't really even ask. So we came back. She told us to come back in a week to repeat the labs to see if they were, so we did labs that day, and they were bad. His hemoglobin and his platelet levels were both low. His white cell was normal, so they did not suspect leukemia. They suspected ITP, and gave him the flu shot and told us to come back in a week to have labs rechecked. In the meantime, he started running fevers, obviously from that mess, and he ran fevers of 104. So finally by day 4, I was like, I'm not doing this anymore. I'm going to call in the morning to have his labs rechecked early. I put him in the bathtub, I bathed him, and when he got out, he had petechiae from the neck up. So I took him in the morning, we repeated labs. His white count was still normal, but his hemoglobin and hematocrit and platelets were still low, and I told him I wanted to see an oncologist now. So the next morning we were sent to Charleston to the oncology specialist.
And then what happened?
They drew labs that morning. About 10 minutes later, we were in the office. The doctor came in and looked at the blood smear and said, "I'm sorry to tell you, but your son has leukemia." Nobody told me, and I'm a nurse. We weren't taught anything in nursing school, but that you just give them, and this is the schedule.
Did he have to have ghastly treatment?
He had 3 years and 2 months of treatment. He had 23 or 4 spinal taps with chemotherapy that crossed the blood-brain barrier. And he had a lot of side effects, long-term side effects from the chemotherapy.
Unbearable for you as a mother to have to go through that.
Yeah.
But today, how is he today?
Ethan is 14, almost 15 years old, and we have done a lot of natural detoxing and lots of therapies, natural therapies and such to help with his long-term side effects. And he's doing good.
No leukemia?
No leukemia. We get checked every year. Ethan was a very bubbly, happy child, and when he went on chemotherapy and high doses of steroids for that long, his personality changed. He's very reserved and just reserved and cautious. I feel like some of the treatment kind of changed him.
So, that flu vaccine, was that the last one he ever had?
Yes.
Thank God.
Yes. We do not vaccinate any longer.
And you have other children?
I do. I have a 7-year-old.
Same father?
Yes.
And that child had any vaccines?
They gave the vitamin K shot against my will, but he's had nothing else. And
how's he?
No leukemia. No leukemia. Yeah.
Has any medical professional ever told you that? Do we know that leukemia is linked to these shots? What shots did he actually have at 2? I don't think you said.
There were several of them, I think 3 or 4 that on the schedule that they normally get. When I looked at the vaccines, I noticed that there was formaldehyde in them, which we know has an MSDS sheet that says that it's carcinogenic and can potentially cause cancer. Ethan has MTHFR gene mutation. He has several copies of each of those mutations, and that prevents him from detoxing properly. Of course, we didn't know that before.
Got a terrible story, but I'm so pleased that he's on the mend now, that he worked so hard.
Yes, he is.
What's your warning to the parents outside of this story?
If you have a gut feeling that you shouldn't give them, don't. You need to be asking questions about ingredients, potential side effects, and you need to make those decisions based on what you as parents feel comfortable with and not comfortable with, and don't let anybody sway you.
Is there anything else you want to tell them?
Just don't vaccinate your children.
Thank you so much.
You're welcome.
The incredible service members.
And we owe you our freedom.
The Pentagon is going to require vaccines for all service members.
I'm asking the Defense Department to look into how and when they will add COVID-19 to the list of vaccinations our armed forces must get.
Leaders did everything legal or illegal within their power to coerce and influence their service members to get the shot.
Her son and 9 other Marines were being held in confinement in the brig until they got vaccinated.
If you don't do what they tell you to do, they will ostracize you. They will destroy your life.
8,000 well-trained men and women were fired.
I lost my ability to feed my family.
I mean, I'm being told you're getting dishonorably discharged.
You cannot mandate an experimental medical product on military members.
The impact is really on the entire nation.
I had a battalion commander come to me and she said, "Dear God, we're killing our own soldiers."
When we talk about orders that are unlawful, now there is a duty to disobey.
.46% of the American people say mandates are dangerous, they're damaging, and vaccine science isn't settled.
The steady decline of childhood vaccine rates. Vaccination rates continued to decline last year.
There's a discourse about vaccines that didn't exist before.
Children's Health Defense.
Children's Health Defense.
Children's Health Defense.
Children's Health Defense.
Children's Health Defense is the leader in the health freedom movement.
The Department of Health and Human Services is overhauling the immunization schedule, now only recommending 11.
We are making recommendations that are science-based, that are common sense.
Secretary Hegseth discarding the mandatory flu vaccine requirement.
Your body, your faith, and your convictions are not negotiable.
People recognize you have to be able to make an individualized decision.
For the first time, the U.S. FDA will acknowledge that COVID-19 vaccines killed American children.
States are putting in place medical freedom laws. There's bills in Congress that Children's Health Defense is supporting, the GRACE Act for the right to religious exemptions, the End the Vaccine Carve-Out, ending liability protection, and Tom Massey's bill to repeal the PrEP Act.
One of the most aggressive medical accountability lawsuits in decades.
Suing the American Academy of Pediatrics.
CHD is suing under RICO laws, claiming that the AAP operates as a criminal enterprise and has for decades.
A federal judge yesterday blocked Robert F. Kennedy Jr.'s recent overhaul of the nation's childhood vaccine schedule.
And they basically just froze all vaccine policy.
The American Academy of Pediatrics and other medical groups filed a lawsuit arguing the vaccine changes violated federal law.
Which is outrageous for a single judge sitting in Boston to stop any work at the Centers for Disease Control related to vaccines.
This conflict between medical freedom and medical coercion, it's a fundamental conflict that we must resolve now in favor of medical freedom or forever be truly slaves to medical tyranny.
I am so glad that there are people like you who are still fighting this.
Children's Health Defense. If you don't know what they do, folks, look it up.
We have got to, as a society, global, decide, is medical coercion okay, or do you have a right to decide what happens to your body?
This and all CHD TV programming is made possible by generous support from viewers like you. Please consider making a contribution today to keep our programming going strong. Thank you.